Hi guys, Dr. Afan here, and today we're going to be discussing what do you do if you have a gap in your smile. First of all, if it's a small teeny weeny gap, it may be that we do some form of teeth straightening or we add a small amount of composite into the gap to close the gap altogether. But let's say you've got a full tooth-sized gap. What can you do? First option is just leave it and accept the gap. And that might be the case if it's a back tooth that's missing. There is lots of evidence now called the shortened dental arch approach to dentistry, which is actually looking at whether we actually need all our back teeth to live and sustain health. And sometimes, if it is a very back tooth, you may not need to do anything with it and we just accept that there's a gap there. So that's option one. Option two is something called a bridge. So a bridge, as the name explains, is a bridge. So we're bridging the gap. And what do? We're hanging the bridge off the tooth behind. So let's say if I've got a tooth and this is the tooth behind, this tooth is then going to be the anchor putting in the bridge. So what we can do is something called a sticky bridge, where we put glue on a metal wing or a white colored wing, and then that glue sticks onto the tooth next door, and then the tooth, the temporary or bridge tooth or the fake tooth, then goes in, but it's hanging by this wing here. So if you was to bite on, let's say, a sticky toffee on this part of the tooth, guess what will happen? It's more likely to lever and ping off. So you need to be careful if you do have a sticky bridge inside your mouth. If you have a more conventional option, which is a little bit more invasive, so we try not to do this quite frequently, I can't remember the last time I actually did one, is where you file the tooth next door and maybe file the tooth on this side and then stick two crowns with a fake tooth in the middle. So that's a conventional bridge where you've got two healthy teeth or two broken down teeth that you've shaved down to put two caps on, and it just so happens that that's fused together with the middle part. Alternatively, you can just have one part to that, so not two teeth, but just one tooth with the fake tooth as well. So that's a more conventional approach to putting a bridge on as well. So those are a little bit about bridges. An alternative option might be a dental implant. So a dental implant is a very teeny weeny screw that goes into the jawbone. It needs a certain depth and width of jawbone to be able to insert it. So sometimes if your jawbone doesn't allow that, you may need a small bone graft before we put that inside your mouth. Once that goes inside your mouth, we can then screw a tooth on top of that small implant. So essentially, that's another option. The final option is a denture, false teeth. And with false teeth, you can have them in all shapes and sizes. You can have one for just one tooth, or you can have a full upper and lower set. Lots of different options. So in essence, you can leave and accept the gap, you can get a bridge, you can get an implant, or you can get a denture. And if you're getting a denture, you may look at putting a small implant underneath the denture to hold it a little bit more so as well. So those are the options for closing a gap. It would be nice to sit down and discuss this at length. So if you have any questions, let us know, let our team know, we'll be there to help. Thank you.